comparison between COVID-19 and 1918 Spanish influenza pandemic, presented by Cristina Rodriguez. In the 20th century, there arose several pandemics worldwide, but the most lethal of them all was the 1918 influenza pandemic, also known as the Spanish flu. It received its name during World War I because at the time Spain was neutral to the war. So there were no implications for sharing the news to the public. However, in other parts of the country fighting the war, governments repressed the reports, such as the U.S., for concerns of chaos. The Spanish flu killed roughly a third of the world's population. That's 50 to 100 million people. Most of the influenzas were developed in Asia due to crowded places and closely related incidents with birds. There were 3 waves that spread throughout Europe, Asia, and North America. Although the datum was incorrect of its origin, the first wave was in the spring of 1918, U.S. military personnel. During this time, many soldiers were being deployed to U.S. and France. Some soldiers were returning from or going home to visit. The reason why it got so bad back then is because of these deployments, of these times where soldiers were going and coming home and visiting while they were sick. There was also Chinese laborers in other parts of the country. They were being shipped, or they were in trains in the rail lines, and they too were also getting sick. No one knew where it was coming from. No one knew how it happened, how to take care of it, and so it was spreading like wildfire. It is hard to tell if it was hard to tell then if we could expect another pandemic, because the medical officials in the medical field back then were not at advance. They were no near research. Research had not started since the 1920s and 1930s. That's when they started collecting data to find patterns of flu-like incidents that would occur annually, but with lower death rates. The coronavirus is considered a novel virus. Coronavirus is a new coronavirus that has not been previously identified. Symptoms run from cough to unexplained loss of taste or smell, to headaches. Some may have symptoms, some may not. The family of coronavirus is known for its name because corona stands for crown. And under the microscope, the cell of the virus, you can see the protein spikes around the outer shell forming a crown-like structure. Some of these coronaviruses affect humans, others affect animals. Sometimes the viruses jumps from animals to humans, creating pandemic. The reason why it is getting so much attention is because this coronavirus is new, just like the Spanish influenza. It is being transmitted. It was, or so they think, it was transmitted from animal to human in the wet market in Wuhan, and now it's being transmitted from human to human, and people are concerned. People are concerned because of the number of deaths, the confirmed cases globally, and its severity to affect, and how long will this last? There is no one who has immunity to it. The effects are affecting the elderly from 65 and up. If it affects children, now they have a milder case of symptoms. There's no vaccines. The death rates then and now are high for for the population. We are not sure if this issue will arise again, if there will be a second wave, but we are now more sure that we are more prepared for the second wave if and when it does come. I am so grateful that this pandemic has not affected my family, and it actually has turned our family situation around, and I couldn't have asked for a better timing. What will happen fall semester? I am not sure what exactly is going to happen, but I do know that President Castro of Fresno State reassured us that they have a plan. We most likely may continue virtually in the fall, and I'm okay with that. And that is my presentation.